Baguio, your student nurse for today. So before we start, can you verify your full name,
Vince Policarpio,
age,
22,
birth?
May 3, 2001.
Okay, so how are you feeling today?
I'm fine.
Do you feel comfortable in your position?
Yes.
Okay, so before anything else, I need to close the curtain for your privacy. So as we do this, I'm going to start by checking all of your cranial nerves, and then we're going to check your coordinations, and then going to check your sensation. Also, we're going to do some deep tendon reflex. So we'll start out by just talking with you, and we're doing what's called a mental state. So first, after noticing your behavior, you're awake and alert and cooperative and responding well. I'm also noticing your cognition, so I'm going to ask you some kind of side questions, okay?
Okay.
So can you tell me what month today?
May.
Okay, now that's correct. And can you tell me who your favorite president?
Duterte.
Okay. Can you tell me who I am?
Nursing Leader.
Okay, that's good. Last, can you tell me why you're here today?
For the checkup.
Okay. Alright, next, your dress is appropriate, your effect is appropriate, and also I need to screen your depression and suicidal thought. Do you feel like hurting yourself?
No.
Have you felt depressed and unhappy lately over the past 2 weeks?
No.
Okay, alright. So we're going to move on for the cranial nerve number 2, and that is for visual acuity. So we check your visual acuity today, and we will check it for this assessment as well as using the slowing art or paper. I change standing 20 feet away. We would check both your right and left eye, and your vision is 20-25 in both eyes. And continuing on with the cranial nerve number 2, we would do a concentration test. Can you place this over your left eye, and then I will place the over my eye, and tell me when you see my finger. Ikaw, sir.
Kita ko po. Opo. 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 Kita po. Opo. Kita po. Nakita po.
Okay. Your peripheral vision is intact. Now we're going to check cranial nerve number 3, 4, and 6. And I want you to follow this pen in the 6th cardinal position of gaze, keeping your head straight. Okay? So just follow this. I'm going to bring it toward your nose. Alright, sir. Thank you. Good accommodation. And then I'm going to shine a light in. And I see the pupils both of them respond to light. Okay. Then moving on, cranial nerve number 5. Number 5 in sensation where we're going to look at some movements of your face. That you can smile po, frown, and show your teeth. Okay, just smile, sir. And I'm just going to check the muscle. Okay. Okay. Then in sensor function to this cranial nerve. So can you close your eyes and tell me when you feel the contact?
I can feel it. I can feel it. Opo. Opo.
Okay. Open your eyes, sir. Moving on cranial nerve number 6, we're going to move on to cranial nerve number 7. And can you lift your eyebrow up and down and smile?
Mm.
Moving on cranial nerve number 6, we're going to move on to cranial nerve number 7. And can you lift your eyebrows up, down, smile, from it, and can you squeak your eyes closed real tight and then open? Alright, okay. Yes. Next, cranial nerve number 8 is the acoustic, and I'm going to whisper something in your ear, and I want you to repeat it.
Wood.
Okay? Now,
Love.
okay. Last.
Cafe.
Okay, alright. Your acoustic nerve is intact. And then, moving on for cranial number 9 and 10. So, can you open your mouth really wide and say ah?
Ah.
Okay, I see your uvula goes up, and so Paretus document indicates that cranial nerve number 9 and 10 is in 10. And then cranial nerve number 11, can you turn again my hand? Closer. Okay, uvula. Okay, and shove up against my hand. Okay, and cranial nerve number 11 is intact. Now we're going to check muscle strength. So we'll start with upper extremities. Can you please hold your hands out like this? Okay. And we would do that for a count of 10. And then can you squeeze my finger? Okay. And then for the lower extremities of heavy lay back for a minute. And I want you to lift this leg up of the bed. And we would do that for a count of 5. Up, sir. 1, 2, 3, 4, 5. Then 1, 2, 3, 4, 5. And then can you press down against my hand? Pull up against my hand. Okay. Alright. So now we're going to do some tests of your coordination. So can you just if you touch your each finger as quickly as you can and do it with the other hand. Okay. Good, sir. Alright. Good. And now touch your nose and touch my finger both as quickly as you can. Up it, sir. Okay. So we're going to check coordination of lower extremities. Can you take your shin and just end your keel? Just run it down your shin. And then can you stand up for a moment? And we're going to the Ramburgis test. Put your feet together and put your hands and stand up straight and close your eyes. And we would count to 20 seconds and you should be able to maintain this standing straight. Down, sir. And then walk a couple steps, 3 or 4 steps, just normal, and then come back and walk heel to toe and relax your arms. Okay, good. Your coordination is intact, and then we're going to check the sensory system. So the first thing that I'm going to do is checking your sharp blood discrimination. So start, close your eyes, then you're going to tell me whether you feel sharp or dull. And do this all over.
Dull. Sharp. Dull. Dull. Sharp.
Okay? Alright, you can open your eyes, and then we're going to check your light sensation. I'm just going to use a cotton ball, and I just want to say yes when you feel that and no it. Close your eyes.
Yes. 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 Yes.
Okay? So, open your eyes. Alright, good. Last thing, eyes closed and hold your hand and tell me what's in your hand. You can feel it. Close your. Ano po yan?
Cotton.
Okay. Thank you, sir. Open your eyes.
Pen.
Okay, last thing is the babu sign reflex. So we're going to draw J at the side of the foot. Okay, that's all, sir. Tapos na po ang ating assessment, and thank you po.